Hello, in this video I shortly introduce my personal information, some information about my country and about the project. To say shortly, the project is about study and integrate innovative approaches from leading countries and implement them in Georgia, which is vitally important. And design and pilot innovative prevention and intervention strategies, including digital tools and tailored to the Georgian context. First of all, I'd like to inform you that for me, participating in this project will be a big chance to learn from a different perspective. Now about myself. My name is Nino Naneishvili and I am an assistant professor of psychiatry at Tbilisi State Medical University in Georgia. First, I started as a general psychiatrist and then became child and adolescent psychiatrist. I work in an outpatient clinic of the Center for Mental Health and Prevention of Addiction in Tbilisi. We are registered and I provide dynamic monitoring patients mainly with mental retardation, psychosis, genetic problems, conduct disorder and autism, which is also big challenges for us. Another my job is neuropsychiatric center, where I work as a general psychiatrist and as a child and adolescent psychiatrist. I am involved in a crisis intervention program where I mainly examine and consult patients with OCD, which is a very big challenge also in Georgia. Eating and feeding disorder, depression, anxiety, ADHD and self-harm. The Crisis Intervention Center is financed by the city government and offers psychotherapy to small numbers of children and adolescents. The center serves just 15 patients per month. We have 4 centers in Tbilisi and there is no crisis intervention center in the regions of the country. It is a drop in the ocean, so we can say that we have in Georgia lack of services. Now I'd like to introduce my country, Georgia. Georgia is an old Caucasian country with a complicated history of strife and displacement. A lot of political, social, psychological changes has happened recently. For example, 300,000 internally displaced persons have been forced to leave their homes because of 3 wars which we had recently. There is also a lot of poverty and hard economic problems. Additionally, Georgia's all 4 neighbor countries have experienced military actions, military conflicts, and there is a great military political tension as well as economic social difficulties in the region. Why I am interested in self-harm? I became personally interested in this topic when I realized that non-suicidal self-harm had increased over the last 3 or 4 years. At least one patient, especially girls, arrive at the visit every day with self-harm, which really surprised me. Why? Because only a few years ago, there were practically none of these patients in Georgia. Suddenly, I met a serious problem and appeared numerous questions. Why do teenagers self-harm and engage in self-punishment? It looks like became as a trend. The most important thing is to understand the situation philosophically. To analyze what mistake was done by the preceding generals. In contrast to earlier, previous generations, why does the current generation lack self-esteem? We also can think about generational transmission of trauma. So transmission of trauma from generation to generation. I was also perplexed by it, and still nowadays I think, for what reason did we accept the new challenge? What has happened in our environment and why we have so increasing numbers of self-harm? What led to this new diagnosis? I try to understand myself what kind of psychological factors may lead to self-injury behaviors. How to enhance adolescents' mentality to avoid copycat, avoid peer influence. After my personal experience, I started searching, dug into literature, and found that it is a serious public health problem, and self-harm is increasing phenomenon globally among adolescents. It was found that cutting and scratching are typically forms in Georgia, and they usually do not need emergency treatment as they do in abroad countries. Empirically, in Georgia, the number of self-injury is increasing, and particularly among displaced teenagers. That is why the project is titled as a non-suicidal self-harm among children and adolescents of internally displaced people and their peers in Georgia. My project has a special focus on internally displaced people, and this research will study both internally displaced people and their peers, to understand how common self-injury is and why it happened. The objectives are to bridge gaps in knowledge and practice regarding self-harm. The structure of the project is standardized. Background, project aims, existing problems, gap in current knowledge, methods, solutions, the broader impact, clinical and non-clinical management, sustainability and personal component. And of course, short about the importance of this fellowship. The project has clear goals. First, we will collect data to find out how many teens in Georgia do self-harm. Second, we will create tools to help. This includes platforms, make smartphone applications to help teens manage their feelings, and create virtually reality applications to teach them how to stay calm. We will also make a website with information for patients and from patients, parents and professionals. Third, training. So problems gap in current knowledge. So existing problems are: there is no epidemiological data about self-harm in Georgia, and therefore we have no prevalence. ICD-11 is not adopted yet. Researchers has no ideas about reasons of harm, reasons of harm is not so clear and not studied. Peer influence. The impact of online has not been studied. We have no effective supportive strategies. And finally, about prevalence. Not prevalence, but now about prevention. So we will conduct research. Developed country adopted diagnostic criteria, standardized Georgian language data collection instruments, and assessment protocols for self-harm according to ICD-11 guidelines. We will try to find reasons why adolescents address self-harm. Increase of adolescent self-esteem, self-knowledge, and decrease peer influence create effective supportive strategies. It is necessary to work with Ministry of Education, Ministry of Health, with mayor, and creating regions crisis intervention centers. Create research center. Of course, mass media and new technology will be involved, help to improve worldwide understanding of self-harm in conflict zones and general populations. Mostly we will work into six directions: conduct research, work with psychiatrists, work with school teachers, work with school doctors, work with school psychologists, with parents and with students, teenagers. Which methods will be used? Of course, clinical interview, gathering information, anamnesis, use diagnostical skills, standardized data collection instruments, ICD guidelines, new approach of diagnostical criteria. Teachers will be trained about recognition of risk factors. School doctors, school psychologists, parents, teachers will be informed about warning signs to watch for. School psychologists will be trained about short emotional regulation program which they will provide among teenagers. So we will use 3-4 evidence-based innovative methodologies, like for example school-based early screening test, emotional regulation checklist, early adolescents skills for emotions, and dialectical behavioral therapy, short dialectical behavioral therapy applications. And together with IT specialists, we create digital tools, which I have already mentioned. For teenagers, we create mobile applications and create preventive programs for them. About the broader impact, this project is not only about research. Through this project, all stakeholders will receive effective support strategies which we need in Georgia. It is about improving the levels of thousands of vulnerable children and adolescents who suffer in silence. The findings will be useful to politicians, healthcare practitioners and teachers. We will investigate how effective new these innovative methods are in Georgia, and then share our findings with increasing interested parties, both locally and internationally. And finally, I would like to express my sincere thanks to you for this opportunity. This project is a unique opportunity for me to gain experience from international experts, enhance my research skills, increase awareness about self-harm, and build sustainable collaborations. I and my team will be happy to play a role in reducing prevalence of self-harm and promoting healing. Thank you very much for your attention.